Hi, my name is Grisel Alfonso Gonzalez, and today I want to share detailed information regarding the effects of sexual health education and sexual risk taking behaviors in low income women living in the United States. There are multiple factors that need to be taken into account when analyzing why individuals engage in sexual risky behaviors. In this case, young emerging adults are at a higher risk of engaging in such dangerous behaviors. A study conducted by Courtney, Nathan, and Tammy reported that 1 in 6 low income women reported they engaged in unprotected sex and traded sex with a non primary partner, which places these women at a higher disadvantage and greater risk to be exposed to HIV, AIDS, and sexually transmitted diseases, along with intimate partner violence and unplanned pregnancy. According to the Center for Disease Control and Prevention, a survey conducted in U.S. high schools in 2017 reported that more than 46% of sexually active high school students did not use a condom the last time they had sex. That me mention the best way to battle this issue is by raising awareness and dedicating more time to sexual health education. Intimate partner violence, unplanned pregnancy, and unprotected sex are all risky behaviors that could be intervened if women were given the right tools and support. A study conducted by Tornello analyzed how timing and sexual health education had an effect in young, low income women's decision when becoming sexually active. The study concluded that women who received early on education were more precautious and aware of all the risks, which helped them to be more prepared. In a similar study that observed African American women population, it reflected that there is a high connection between being from a low socioeconomic status or living in urban neighborhoods and being at a greater risk for violence exposure and sexual risky behavior. Cultural factors play an important role in identifying why sexual health education can have a huge influence in decisions that are made afterwards when taking the step towards becoming sexually active. Educational level, socioeconomic status, family value, ethnicity, and sexual preference can either increase or decrease the chance of an individual engaging in sexual risky behavior. Now, low income women have less possibilities and are placed at a disadvantage when it comes to seeking support or guidance regarding STDs, HIV, or contraceptive methods. Now, family can play an important role as education begins at home. And being this such a difficult topic, parents can either be of assistance with their child making better decisions or not by bringing awareness to this topic. As mentioned in the study, one sexual preference can guide the path towards decision when engaging in sexual activities. In this case, low income bisexual women were at a higher risk than heterosexual women. And by this being meant, bisexual women will either engage in intimate sex with both men and women, where heterosexual women would be just with men, which there is a higher percentage of a bisexual woman having greater risk of either having an unplanned pregnancy or obtaining HIV, AIDS, or an STD. Now, this research focuses on low income women. Low income women do not have the same resources, money, or guidance that higher income women do, which leaves them at a greater exposure to engage in sexual risky behaviors due to the lack knowledge regarding contraceptives and protected sex. Socioeconomic status has a huge effect on low income women, both in their mental health and physical health. Ethnic minorities may feel afraid and untrustworthy of healthcare provider, which leads to failure of seeking healthcare services, which then leads to women who are living below the poverty line are more likely to contract HPV. If they are not aware of how to protect themselves, if they are not aware of whom to go for regarding information, if they are not aware of what are the symptoms or what are the risks involved in engaging in unprotected sex, then that leaves them exposed to contract and get infected. And then it's difficult for them to go to a healthcare provider as it is very cost effective. And a lot of minorities are afraid of seeking healthcare services. And now we want to look at the effects of poor education. The higher the educational level that one has, the more aware and knowledge one attains regarding the importance of engaging in sexual activities by taking the right measures. Education is very, very important as such a high percentage of risky sexual behavior happens due to the lack of knowledge considering exposures to STD, HIV, AIDS, or unplanned pregnancies. And a study conducted by Wayman and Aronson in 2016 looked at students that were attending college. Now, when a student is attending college, it is expected of the student to have certain education and awareness of contraceptive methods and how to take care of themselves in order to not contract an infection and prevent an unplanned pregnancy. But even with all of this information, he reported that 95 students that were attending the college who mentioned to be sexually active, of 3%, did not use condoms while engaging in anal sex. And a 9% stated that they never used a condom while engaging in vaginal intercourse. Continuing, I want to take a look at sex education in schools and the consequences. So low-income women should be provided with more options and sources to gain knowledge about contraceptive methods and protected sex. A study conducted in 11 low-income communities, women reported that they would engage in sex in exchange for money or drugs. Many of these women did not have any educational backgrounds. There was also narratives of different low-income women shared that when they attended secondary school, they did not receive the best sexual health education, as many of them stated that they felt dissatisfied because of the lack of information. Now, the second cultural level, it's family values. Family is very important as family is our backbone of support. Parent intervention is ideal and has tremendous effects on variables and risk-taking behaviors for young emerging adults. Family values play a big role when it comes to accepting and guiding the teen if they are ready to engage in sexual activity. Research shows when parents provide guidance, children are less likely to engage in sexual risky behaviors as they are aware of what are the risks. Now, when a teenager is denied to express themselves or discuss their sexuality due to family beliefs or values, it can lead to risky behaviors. As well, it would push them into seeking information from other sources such as pornography or peers, which are not the most credible sources. And their clinical implications. The clinical implications that are most worried about is raising awareness regarding contraceptive methods, STDs, HIV, AIDS, and prevention of unplanned pregnancies, providing more courses and sexual health education classes to the minorities, especially populations of low socioeconomic status. It would also be helpful to raise funds to help with costs towards protection methods for low-income women who cannot afford healthcare services. And last but not least, schools should provide training for parents in order to handle and provide guidance to the young adults and other family members. For future research, there should be a focus on better educational programs, more cost-effective contraceptive methods, parenting guidance based on ethnicity, as everyone has different teaching methods, and maybe someone who is born in the US has a complete different method and strategies or advice for their children from someone who might have come into the United States and is from a different country. So I believe it would be very interesting to take a look at the teaching methods from all around the world regarding sexual health education at home. And last but not least, public versus private school sexual health education curriculum for students. Is it different from public to private schools? What can we learn from what we have missed in the past to help our youth? So this presentation has come to an end, and I hope you all enjoyed it. Here I will show my references for further information. Thank you so much. Now, my first cultural level, it's educational level. In 2001, according to the U.S. Department of Commerce, from the population living below federal poverty level, a 33% obtain a high school diploma, and only a 9.3% obtain a college degree. And women who have obtained a post-secondary degree have a better advantage at a better education and becoming more educated regarding sexual health. Low income leads to limited education, limited resources, and lack of knowledge regarding sexual health and being exposed to risky decisions.